going to move on to our next presentation, and I would like to introduce to you Dr. Molly Colvin. She is the director of the Learning and Emotional Assessment Program at Massachusetts General Hospital, also called the LEAP program, and she is the assistant professor of psychology at Harvard Medical School. She has expertise in the assessment and treatment of neurodevelopmental disorders, including muscular dystrophy. She was the co-chair of the psychosocial committee that developed the latest care consideration guidelines for Duchenne muscular dystrophy and presented to families and providers attending Parent Project Muscular Dystrophy and Duchenne UK meetings. So thank you, Dr. Colvin, for being with us today. I will go ahead and stop sharing and you can go ahead and present your slides.
Excited to be here today to talk about psychological care for families with Duchenne. And I want to start just with the big picture, which is that most boys with Duchenne will show steady developmental progress in the acquisition of cognitive, emotional, and social skills, even with the loss of motor skills. And that we should assume that those with Duchenne will lead fulfilling lives and pursue areas of interest and expertise, as well as to have some meaningful social relationships. But we know that the journey isn't always easy, and that's what I'm here to talk about today, as to how to make that easier for everyone. In a recent study that was published in 2019 looking at caregiver stress for those who are raising children with Duchenne, up to half reported psychological or psychosocial adjustment challenges, with caregivers of children with Duchenne reporting high levels of stress. And that level of stress needs to come down in order to be associated with good psychosocial adjustment. So how do we recognize caregiver stress? I think this is something that's probably important to many of you who are listening today. I want to go back and talk a little bit about the 3 primary responses to stress, and many of you have probably heard about these, and they're illustrated by this cartoon, which is that there's the fight, flight, or freeze response. So biologically, our neurological systems, when we encounter a threat in the world or even a perceived threat, ramps up to either fight that threat, to run away from the threat, to flee, or to freeze and just sort of stay still until it goes away. This has some really big impact on your body's response from a physiological as well as a mental perspective. And so some of the signs of stress that we should be aware of are physiological symptoms. In some people, this is the primary way that they manifest symptoms. So it's noticing things like whether your muscles are tight or whether there are periods during your day where you might have a racing heart or shallow or rapid breathing. Sometimes there can be chest tightness or sweating or even trembling. And when these are happening outside of any other medical concerns, it can be an indicator that your baseline level of stress is a little bit too high. Some of the things that we don't think about as much are perhaps the cognitive symptoms of stress. And I've talked a lot about this, especially in the last year with the pandemic, when for all of us, there's been sort of a low level of chronic stress. And this often has an impact on cognitive symptoms. It's a bit insidious. It comes on without us being fully aware that it's there, but can really impact how efficient our brain system is. And it may even come across or feel a little bit like we are in a bit of a fog cognitively. So what are some of those cognitive symptoms that come along with the fog or might be an indicator that you're under a little bit too much stress? Some of it may be racing thoughts. Some people have worry that they recognize as worry, but some people don't. There can be increased irritability or a sense of fearfulness or just becoming kind of easily overwhelmed, especially in response to emotional stimuli. There can be intrusive thoughts or forgetfulness. And one of the things that I think is probably most common is difficulty concentrating, which can actually make people think that their memory isn't so good. And it's not because they're forgetting things as much as the information just isn't getting in the first place. And that has to do with our concentration not working quite as well. So these are all also indicators of stress that sometimes may come independently of any of those physiological symptoms, meaning people won't report feeling tense in their body or having an elevated heart rate, but they might feel like they're just not quite on top of their game in terms of managing their day-to-day life from a cognitive perspective. With caregivers, we really have to be on the lookout for caregiver burnout because these symptoms of physiological and cognitive stress left unaddressed for long periods of time can contribute to caregiver burnout. And some of the key signs and symptoms are here on the screen. And these overlap with some of the things that we sometimes think about as being signs of depression, and they can be withdrawal from social activities or feeling just exhausted or having trouble sleeping, feeling kind of down or irritable, and as if everything has sort of lost its flavor, or everything goes from color to being a bit black and white. And it's not necessarily that people will say that they sort of feel down or depressed. They may not. There may not be sort of periods of sadness, but it's a feeling of just being kind of there, but without being fully present. And this can be a real indicator that it's time to pay more attention to psychological health and well-being. So how do we do this? Well, part of it is actually implementing some daily coping strategies. So these are things that just to try to build into your day-to-day routine to prevent caregiver burnout and some of those signs of chronic stress. And it comes back to this, which is really that you have to put on your own oxygen mask before you can take care of your child and your family. And so it's really important, and I know everybody has heard this before, and you sort of probably are even tempted to roll your eyes as I put this up, but these things around having a regular schedule and maintaining sleep and getting time for exercise and make sure you're eating well are all things that are hugely important in taking care of your psychological well-being. Easier said than done. And so I think for everybody, what I would encourage is even if you find 10 to 15 minutes in a day to put aside for yourself, that is doing something that is self-care. This can be as simple as being the person who takes the dog for a walk after dinner. That 10 to 15 minutes of being by yourself and taking a walk and noticing what's happening around you and just taking a minute to breathe and maybe listen to some music or notice some flowers or be in your own garden or even to just take a shower and spend a couple extra minutes just being in your own space and checking in with your body and your mind and finding something that sort of feels like it's a break for yourself. If you build it into your routine and start small, just even the 10 to 15 minutes a day, it can have a really big impact over the years. And we all know that this is a long journey. And so it's important to do it in these incremental lifestyle steps. Some of the other strategies that we recommend around managing chronic stress are to stay in the present, to really try to focus on taking things one day at a time, and to slow down your mind when it gets to be too active. The people have probably heard about mindfulness, which is not I think it's easier said than done, which is about slowing things down and noticing the small things in your environment or appreciating things that are around you. Might be just that it's sunny today, or that you had a really good coffee this morning, or that your neighbor's flowers are blooming. Those are things that sort of bring you back into the present and into your environment and give you an opportunity to check in with your body and your mind about how you're doing. One of the other things I recommend is to make sure that you pay attention to the things that are within your control and try to let go of what you can't. So the things that you can control are how you spend your free time or do self-care, your daily schedule, at least to some extent, how you respond to your children or plan for medical needs or emergencies. But the things that you can't control are things that other people say or do, whether or not there are going to be enough hospital resources or your doctor's going to be there next year, or when a cure will arrive or what the next therapeutic trial will bring. And also government decisions about health or regulation of therapeutics. Those are all things that you kind of can't. You can work towards them, and sometimes it's helpful to join committees and organizations that do sort of ultimately have an influence over these things. But in the end, the things that you have to first identify and pay most attention to are the things that you can control, especially when you're feeling stressed. Social support is key. And so it's really important to make sure that it's there. And it can be small things like making time to talk to friends and family and keeping topics focused on the things that are within your sphere of influence, that under the umbrella of the things that you can control. Identifying community resources, like all of you are here today, so you've already done this. You can check this off the box. You found an opportunity and a place where you can seek support and be connected to people who are going through some of the same things as you are. And then often people find a way to find meaning and finding ways to support others who are in need. And it's really important to also remember to let others know if you need help. And sometimes it's better to plan for this ahead of time and to sort of know who you might call if things start to feel overwhelming. How do you support your family? So if you're doing a good job of trying to do some self-care, then you're doing the first step. But there are other things that come along with taking care of your family. They also need to take care of basic needs. So following a regular schedule with sleep and exercise and good health and good nutrition are all things that are also important for your family. But the other things that you can do are to be a role model by taking care of yourself, making it explicit that you're going to take the dog for a walk because you need a few minutes to yourself. That allows the other people in your family to sort of say, oh, okay, I guess I can do that too. Planning fun family activities. There are things to do and to look forward to that are time to just spend without thinking about the stress of what else is in your life. Choosing to respond with love and kindness. Now, this is something that is often difficult when you're under stress, but it's if you practice sort of taking a minute and saying, okay, I really want to sort of snap at somebody who left their shoes out for the third time and when I ask them not to, but I'm going to take a second and take a breath and say, again, can you please put your shoes away instead of yelling or getting angry? In the long run can be something that builds positive influence with your family. Making time to talk together about worries and nurturing your partnership if you have one. These are all things that are really important to do and to stay focused on your family so that you have the energy in your bank to be the caregiver as well. One of the questions that I get the most is how do you talk to your children about some of the sources of stress that may be related to Duchenne, but also may be related to just living in the world? I think the thing that I like to say is to think about it as having a series of mini conversations rather than one big talk. Picking the right time is something that, I think often with these things that are big and heavy and weighted, we feel like we need to call a family meeting and everybody sit down and we have a long conversation. And for some families that may work, but more often than not, these mini conversations take place in the car when somebody is like sitting next to you or behind you and they start to ask questions and then the conversation evolves from there. And in that moment, I think it's really important to take a breath and not to panic and say, okay, I don't have to have all of the answers. And to start with asking questions about what your child knows. What do they understand? What are they curious about? And then to make sure that you use language that they can understand. It's hard to do this if you're in the car, but to monitor their facial expressions and their body language for signs of stress so that you know whether you should keep going or you should back off and maybe leave it for another day. But the biggest thing that you can do in these conversations is to reassure them that you will take care of them or their sibling and that you're doing the best that you can because they want to feel safe and secure. And so by doing these things, sometimes these hard conversations become a little bit easier. And you're also setting the stage for future hard conversations as well. Now, one of the things that we've spent a lot of time thinking about in the last few years is that we're beginning to recognize that there is an increased risk of certain neurodevelopmental conditions in those with Duchenne. And this can certainly complicate the journey. But I think the reason I raise it is because I also feel passionately that the early identification of these concerns can lead to interventions that also really improve family functioning and quality of life for those who have Duchenne. So it's really important to be doing these things and to monitor for these things, especially in our younger children. So the first step to identifying or taking a look at this is really to think about your child's overall development. How are they doing in terms of memory and language and the development of their cognitive skills? And their pediatrician is going to be a really helpful, and the pediatrician and their teachers actually are going to be really helpful in partnering with you to know whether these things are on track. But some of the things that you probably will notice before they would are things around emotional and behavioral regulation skills. So if there are any concerns about attention or resilience in the face of the unexpected, or around their mood, but also around social skills. So thinking about all of these different spheres is what I would recommend in terms of knowing whether there may be an additional area of concern. And the reason that we are beginning to pay more attention to this is that we understand now more than ever that dystrophin plays a bigger role in muscle development and function, but isoforms of it are also found in the brain. And depending on the nature of the genetic mutation for Duchenne, there can be changes in brain development that then manifest as neurodevelopmental conditions. And the places where dystrophin tends to be most highly represented in the brain are regions that are involved in learning and memory and emotional regulation. And so the reason we pay attention to those domains that I was telling you about earlier is because of this new understanding of how dystrophin is expressed in the brain. So what are some of the common neurodevelopmental conditions that in Duchenne? There are higher than usual rates of intellectual disabilities, learning disabilities, ADHD, autism, anxiety, and OCD, or obsessive compulsive disorder. And I'm going to just give a brief overview of each of these things and some of the signs and symptoms, so that if you have concerns, we can talk about where to go next in terms of seeking help. Intellectual disability means that your child is making steady developmental progress, but that their skills are uniformly falling below age-based expectations in a way that their developmental trajectory will be such that they will need to support functional living skills, but may need support sort of throughout their life in terms of managing day-to-day affairs. A learning disability means that a child may have a bit more of an uneven profile. There may be some skills that are totally within normal limits for their age, but that they have certain academic skills that are harder to learn than others. And with Duchenne, I've seen all three of the next ones, which is really reading, writing, and math. So for some boys with Duchenne who I've seen, they have language-based learning disabilities where reading and writing are particularly challenging. For others, I've seen where reading is okay, but writing and math are harder. And so if you have this kind of variability in academic skills, the early signs may be a little bit more general. So when kids are in early elementary school, it may be things like they need more time to complete written work, or that they avoid reading because that's not something they enjoy, but they'll do math for long periods of time. They may need more time to sort of shift between activities. And these are all kind of early signs that there may be something going on with learning, especially if these things are happening in school, and they may need more academic support. ADHD, I think, is a bit of a misnomer, because I like to say that I haven't met a child with ADHD who actually has a deficit in attention. They can all pay attention. They just have a really hard time regulating their attention. They have a hard time paying attention to what they're supposed to pay attention to for as long as they're supposed to pay attention to it. So they can often hyper-focus on preferred activities, like things like video games. But then at other times, you might think that they just can't hear you at all because they're not paying attention to things about, setting the table and getting their backpack ready for school. There can also be associated symptoms of hyperactivity or restlessness and inability to kind of can't sit still. But also, since this is more important sometimes with Duchenne, an impulsivity or a tendency to sort of act without thinking, to blurt something out or to do something without sort of thinking through the consequences. I'm going to talk more about treatments, but I wanted to mention that for each of these at the bottom, there's going to be sort of what the gold standard treatments may be. And then I'm going to talk a little bit more about how you might access these. But for ADHD, it would be medication and psychotherapy. And that's going to be a recurring theme for the next few things that I discuss. Autism spectrum disorder at its core is about difficulties with social communication. It's about difficulties relating with other kids. And there may be a tendency to play alone, or that the play may be repetitive or scripted. It has to go in a certain way. The toys may be used in an unusual way. So in younger kids, when they're playing with the toy cars, they may not sort of vroom vroom them across the carpet, but they would flip them over and spin the wheels. That would be something that you'd be looking for. And there may just be, even at a milder stage, sort of a difficulty understanding what others are experiencing. There can be behavioral rigidity or a tendency to prefer and follow routine and have difficulty adjusting to change, and sensory sensitivities. Although I like to say that sensory sensitivities are not something that are unique to autism. So I like to tell parents, if you just see sensory sensitivities and no difficulty with social communication, then it's not autism, because sensory sensitivities can come along in anxiety and ADHD and a host of other things, but they are recognized as part of the diagnostic criteria for autism when there are additional social concerns. For anxiety, what I like to say is that all kids worry, and especially when they have health-related concerns. And I think especially right now, there's a lot of stress on kids around school, around their health, around the pandemic. And so to some extent, a little bit of worry is normal. When we start to talk about the word anxiety or use the word anxiety in a clinical sense, it's when the frequency or intensity of the symptoms are high and they're interfering with daily functioning. And it may not be all of the time. While some kids do have generalized anxiety disorder where they sort of do worry all of the time, it can be sometimes in more specific settings where you see this, where it may only show up in social situations, or when they anticipate separating from a preferred caregiver or leaving the house, or certain triggers may lead to symptoms of panic. These are different types of anxiety disorders that all warrant treatment and are all treated in a similar way. But when you meet with a psychologist, they'll ask you a set of questions to sort of figure out whether it's generalized or sort of more specific, and that will help to guide treatment. OCD is also one that I think everybody sort of has an image in their mind about what this means, but it doesn't actually match how it presents in real life. There certainly can be people with OCD who are concerned about germs and cleanliness and very neat, but it can be broader than that, and it can also be quieter than that, especially in older kids. But the components of OCD are that there must be obsessions, which are recurrent or persistent thoughts or urges or impulses that pop into a child's mind and are intrusive. They bother them. They don't want them to be there because they cause anxiety or stress. And then they may execute compulsions, which are repetitive behaviors or mental acts, because to neutralize that thought. And so this can be something like, having a worry that if they don't, line something up the right way, that something bad will happen to their parent. And so you'll see the lining up, and that's the compulsion, but the fear, the obsession is really about something bad happening to a parent or a family member. Mood dysregulation is, I think, fairly common also in my experience with boys with Duchenne. There can be some depression that may look like sadness, but in kids, often depression looks a little bit more like irritability and a loss of interest or activities. It looks a little different than it does in adults. It can also, with mood, you may not see sort of persistent irritability that might be indicative of a depression as much as you might see a tendency to have these, what I call kabooms or explosive anger outbursts. And these are often prompted by things like transitions and limit setting, as well as if there are concerns about language and processing speed. Let's talk a little bit in the last few minutes about how you get assessed and what kinds of treatment look like. Your first resource is obviously your neuromuscular team, and that ideally will include something like who has access to a social worker or a psychiatrist who does medication, or a psychologist who may do therapy or assessment. And if there are neurodevelopmental concerns, then you might be referred to a neuropsychologist, someone like me, who does some testing to look at your child's overall functioning and help make diagnostic impressions, as well as make recommendations, and then quantify development over time. For emotional and behavioral interventions, psychotherapy is often the first line of defense, and it can be for both the family and the caregiver, as well as for the child. And then medications, which would be done with your psychiatrist or pediatrician or neuromuscular team, might address some of these individual things that we were talking about earlier, but need to be monitored in relation to the medical treatment. And in particular, we know that steroid treatment can sometimes lower the threshold or the vulnerability for mood dysregulation. Social interventions can be peer education, which I think is sometimes incredibly important in schools when you enlist your child's peers to be their protectors in the school environment. And may also include social skills training or support groups. And participation in group activities, I think, can be hugely helpful for our boys in terms of helping them find a place of belonging, especially as they get older and mobility becomes more limited. For infants and toddlers, when there are concerns, early intervention, this is usually for under age 3, it can be found in your community and sometimes your home. Your pediatrician can make a referral for early intervention services. In preschool age children, there may be services that are available through the public school system. There's often a transition from early intervention to an IEP, or an individualized education program, that can bring services into your child's preschool setting, even if it's a private setting, that are provided by the public school system. In elementary age children, I often recommend that we think about how the medical factors, the cognitive symptoms or learning profile, as well as the social and emotional factors will influence everyday functioning. And then think about how that might lead to decisions about your child's classroom placement, what accommodations they need, and what services they also need. So there are 2 types of special education plans, and I'm not going to have time to get into each of these in detail, but a 504 plan specifies academic accommodations that may be needed for your child. An IEP can include those accommodations, but as well as including services. And the plans can be adjusted over time as needs change. The major takeaway here is with a 504, it should be accommodations or modifications that the child needs. And for those boys with Duchenne, this is a common list of things that I would think about. And then when we get to an IEP, it would include things like if they need learning support or social skills support, or to meet with the school psychologist. Your PT and OT in the schools should also be included here, as well as adaptive PE. Those are all things that can be put into an IEP. And as we move into adolescence and early adulthood, it's really important to think about transition that is developmentally appropriate, and that this is a process that really begins at age 10 and moves through the next 10 years. Some of the things that should be thought about are peer support, dating, relationships, housing, transportation, educational and vocational goals. And I have gone very quickly towards the end of this so that I have time for a few questions. I hope that this was helpful to you all, and I'm available at this email address for questions if you have them.
Thank you so much, Dr. Colvin. Yeah, I think that was a wonderful explanation of things. And I do think that a lot of our parents are kind of in flux right now too, with COVID going on, and are we learning at school? Are we learning at home? And those IEPs, if folks are home and doing the virtual learning, should they still reach out to their school counselor to make sure their IEP
Absolutely. Yes, it's an excellent question. So with COVID, it's varied across the country in terms of the implementation of things, but IEPs should be still in effect. So if your child was eligible for services when they were in person, they should still be getting them even if they're engaged in remote learning. And I would say it's really important to be in touch with your school's team to make sure that that's happening.
Okay. All right. Thank you, Dr. Colvin. It was a great presentation.
Thank you for having me.